Now the diagnosis of ptosis. So how can we diagnose the ptosis, that it is of myasthenia gravis or not? The first test is the eye spec test. In eye spec test, we will advise the patient to keep the eyes for 2 to 3 minutes on the ptotic eyelid. If the ptotic eyelid opens after 2 to 3 minutes of the eyes, then it will be a myasthenia gravis. Because acetylcholine enzyme, the cholinesterase enzyme, this enzyme, it is inhibited by the eyes. When this enzyme is inhibited by the eyes, the acetylcholine will be increased, and this is increased acetylcholine will cause the contraction of the levator muscle, and it will pull the upper eyelid. So the eye spec test will tell us whether it is myasthenia gravis or not. The next test is the antibodies test. We know that in the myasthenia gravis there are autoantibodies against the acetylcholine receptors. So we will do serology, and we can find out the antibodies in the autoantibodies in the blood. The next one is the iridoponium or tenselin test. In iridoponium or tenselin test, this is also a short-acting acetylcholinesterase inhibitor. So it will inhibit acetylcholinesterase enzyme. When this enzyme is inhibited, it will again increase the level of acetylcholine. And when the acetylcholine level is increased, the levator muscle will contract extensively, and it will pull the ptotic eyelid upward to its normal position. So if we suspect from these three tests that it is a myasthenia gravis, then we should also do other imaging tests. For example, we should do CT scan, MRI, CT scan and positron in order to detect the thymoma. Because with myasthenia gravis, in about 20 to 30% cases, thymoma is present in the thymus. So in order to rule out the thymoma, we should do CT scan, MRI, CT scan and positron imaging. Okay, so these are the different tests which we can do for the diagnosis of ptosis. Now the assessment of ptosis. How can we measure that how much ptosis is present? So for this, if the ptosis is unilateral, if it is present in one eye, so what will happen? We will compare the ptotic eye, we will compare the two eyes, that how much cornea, if it is the normal eye, for example, this is the normal eye and this is the ptotic eye. So we will subtract this normal eyelid position. If this is the normal eyelid position, we will subtract it from the abnormal eye, and it will give us the measurement of ptosis. But if the ptosis is bilateral, then what will happen? What will we do? If this is the one eye, this is in another eye, and the ptosis is present in both the eyes, then how can we measure the ptosis? We will measure the ptosis in one eye, and we will subtract 2 from the measurement, and it will give us the amount of ptosis is present. So in unilateral eye, if the ptosis is unilateral, we will compare the two eyes, it will give us the measurement of ptosis. And if the ptosis is bilateral, we will measure the ptosis, how much ptosis is present, and we will subtract 2 mm from that. So it will give us the amount of ptosis is present. It can be mild, ptosis can be mild. For example, if it is 1.2 to 2 mm, it will be considered mild. If this is 3 mm, if from this measurement the ptosis comes 3 mm, it will be considered moderate, and 4 or more than 4 mm will be considered severe ptosis. So this was about the diagnosis and assessment of ptosis. Now treatment of ptosis. How can we treat the ptosis? Before discussing the treatment of ptosis, we should understand the levator muscle function. Okay, so how can we measure the function of the levator muscle? This is the measurement of the function of the levator muscle. This is called assessment of levator muscle function. We will advise the patient that he should start looking from below to above. So in this measurement, if he starts looking from above to below, he will also lift his upper eyelid like this. Okay, so from this we will measure that how much he can lift his upper eyelid. This is called assessment of the levator muscle function. So if he can lift from up to 15 to 18 mm, he will be considered normal. If he can lift 9 millimeter or more, he is good. And if he can lift the upper eyelid by 5 to 8 millimeter, the levator muscle is fair. But if he can lift up to 4 millimeter or less than 4 millimeter, the levator muscle will be considered poor. Okay. So now how can we treat the ptosis? There are medical options and surgical options, but the medical option is for example, for myogenic type of ptosis and for some cases of neurogenic ptosis. We can indicate the medical treatment. But for all other type of ptosis and for the ptosis for which the medical treatment have been failed. So for these all type of ptosis, we will indicate surgical treatment. The first surgical treatment is the facsimile CERVET operation. In this operation, this is indicated in mild ptosis and mild ptosis which is 1.2 to 2 millimeter, and good levator function, and which the levator function is 9 millimeter or more. So what are we doing in this operation? That we will excise the portion of the conjunctiva, the portion of the tarsal plate and the molar muscle. The portion of the molar muscle will be excised. So this is called facsimile CERVET operation. The second one is the levator resection. In this surgical procedure, we are resecting the levator muscle. This is indicated in moderate ptosis and ptosis 3 millimeter, and in a fair function of the levator, in which the levator function is fair from 5 to 8 millimeter. So we indicate the levator resection. Now the third type of procedure is the brow suspension procedure. This procedure is indicated in very severe ptosis and poor levator function, which is 4 millimeter or less. In this procedure, this is also called sling procedure. In this procedure, we are giving up to 6 incision, like to make a hexagonal pattern suture. Okay, so 6 incisions are given to the lid, to the upper eyelid and to the frontalis muscle. Like in a hexagonal pattern, we are giving 6 incisions, and we are passing a fascia from the we take the fascia from the patient's body, and we then pass the fascia like this and form a hexagonal pattern suture. Okay, we are lifting the upper eyelid. This is called the brow suspension procedure or sling procedure.